Good morning, fellow students, faculty, alumni, and friends. My name is Mikaela Momot, and I'm a senior public health and communication major here at UMass. I'm also a first-year grad student in the School of Public Health's 4+1 Accelerated Master's Program, pursuing an M.P.H in community health education. However, if you told me 4 years ago that this is where I'd be today, I would have laughed at you and said, yeah, right. You see, I'm from a small town in Massachusetts called Hadley. Maybe some of you have heard of it. And for almost my entire life, UMass has literally been right in my backyard. I've come to countless performances right here at the Fine Arts Center with my classes in elementary school. I've been skating with my Girl Scout troop at the Mullen Center ice rink, and I've had Special Olympic soccer practices on the fields across from Honors College. So while I originally did not want to be attending college 5 minutes away from my house, I've come to realize that that was a blessing in disguise. A little over a month into my freshman year here, I lost my mother to ovarian cancer, not even 2 years since she was diagnosed. I was completely unprepared for this, as I'm sure anyone would be, but I was really thankful to be close to home during this time. At this point, I was taking time off from school and wasn't even positive that I was going to come back. But I ended up making the decision to return, and I'm extremely grateful to all of those who have helped me get back on my feet and to have continued to help me since then. Now, 3 years later, I am happy to say that I am truly enjoying the experiences and adventures I'm having here at UMass. After all, I might not have stumbled across public health had I been somewhere else. After coming to college as undeclared as possible, attending countless major information sessions, and learning a little bit more about public health in the class My Body, My Health, I am so happy with where I've ended up. It's funny looking back and thinking I had absolutely no idea what public health even was, and now it's jumping out at me everywhere I look. I'm still working out exactly what I would like to do in the field, and I think that one day I will come across it unexpectedly like I did the major. But I know that I really want to be helping people and making a positive impact on their lives. I came to this realization when I was volunteering with the Special Olympics. My older brother has Down syndrome, and I played as a unified partner on his soccer and basketball teams for over a decade. My favorite part of this experience was when I helped the athletes score a goal or make a basket. They would just become so overjoyed and so ecstatic, and that in turn was so rewarding for me. So after I discovered public health, I realized that I could take this passion of mine for helping others and use it in my career. So why else public health? This field is not one for personal gain. It is about helping communities and nations become healthy and realize their potential. It is about saving lives. It compels us to be selfless and compassionate. It requires us to communicate effectively and solve problems. Throughout my courses, I've become fascinated with topics like health literacy, health disparities, social determinants of health, epidemiology, the list goes on. I love that the field is so broad and multidisciplinary and allows me to explore other interests of mine like psychology. And there are so many different paths you can take, which is really exciting, but can also be a little bit overwhelming too. Nonetheless, I am proud of where I am today, and I look forward to seeing where the wonderful world of public health will take me next. Thank you.